Last week, we started a conversation about flooding in several parts of Nigeria. It was reported that at least 28 to 30 states were already affected, with about 500 people losing their lives between July and now. Just in the week that has passed, the federal government has stated, according to the Minister of Water Resources, that it could take up to 30 years of consistent investments to be able to fix the problem of flooding in Nigeria. But what are we doing now? How are we dealing with it? And what are the effects that it would have on Nigerians once this flood passes? There's the risk of cholera coming back. There's a risk of other diseases where people in these flooded areas may suffer from. What are we doing to prevent or fix it? We'll be having that conversation today. And joining us we have
here in the studio Pearl Utuk, who is the Program Officer, Code. Welcome to the show. Good morning.
Thank you for having me.
And of course, joining us on Zoom, we have Dr. Guje Mohammed, who is the Executive Secretary, Yobe State Emergency Management Agency. Good morning, Dr. Guje. Thanks for joining us.
Thank you very much. Good morning. Thank you very much.
All right, so
Dr. Guje, we'll start with you. What's the current situation in your state, Yobe State, regarding the flood, and what's your agency doing at the moment to help those displaced by the floods?
Thank you very much for this question, and good morning, everyone. Good morning, viewers.
morning.
For us in Yobe State, at the moment, we are at the recovery stage, but before the recovery, it was so devastating, especially looking at the incidents and history of flooding in the state. But that does not come unexpected at all. When NIMET released their report early this year, and when we briefed His Excellency Governor Malabuni, he immediately directed SEMA and other relevant agencies to be on alert and to be prepared in the case of unforeseen emergency. Unfortunately, it came with high magnitude. We have seen people of 50 years, 70 years narrating their stories that they have never seen this kind of flood disaster in the whole of their lifetime. So this has come with high magnitude and with a lot of casualties and challenges. But be as it may be, the water has now receded towards communities along the Lake Chad region, and for now, at the moment, as at today, only remnants of water are in communities, and communities are trying to battle with the recovery. It has come with a lot of challenges, with households being affected, a lot of farmland being destroyed, a lot of livestock being destroyed, and lost some lives. His Excellency Governor Buni has been on top of the situation since from the beginning, and for us now at the recovery stage, what we are doing is how do we resettle our people back to their homes? How do we support those that have picked up the pieces and stayed in their communities with basic livelihood support? How do we ensure that the foreseen food insecurity challenges is being curtailed or is being minimized? Because without farmlands, our people are basic farmers. They plant and produce what they eat for the whole season. And now with the farms being flooded by water and without access to farm and with no hope for dry season farming, what are their opportunities? How do they cope with the food security issues in the coming year? So these are what we are battling now: recovery, relocation, and how we reposition the food security issue of the victims of flooding.
Okay. So you've spoken about Yobe State. There are other states like Bayelsa and Delta who are still experiencing this issue, this problem, these challenges. How is your agency now helping those other affected areas apart from Yobe State?
For us at SEMA, of course, across the nation, we have platforms that we relate with our colleagues. And usually, especially when it started in Jigawa, my colleague in Jigawa, of course, alerted me already that nothing will stop the water flowing down to Yobe, so we have to be alert. And of course, that's the same thing that we are doing. And this year's flooding globally, if you see Japan, Indonesia, Sudan, even in America, it has come with an unprecedented magnitude. So for other states like Bayelsa, which are badly affected now, the best thing we shared with them is information and how we have curtailed our own and how we have responded to the recovery issue. Because after the flooding, there's this recovery challenge. But most importantly, we have the mother organization, which is NEMA, which are also on top of the situation. They have their staffs across all the zonal offices, and they have been responding and supporting us with all kind of support, despite the magnitude of the flood this year. So for in our zone, from Yobe, Borno, and even Jigawa axis, we have shared information, and it has really helped in reducing some of the incidences. An example is accessing boat to relocate people or to deliver life-saving support from Jigawa. We moved some boats from Jigawa to Yobe because we don't have the boats on ground, because the location that we are having the incidents has not witnessed flooding in over 50 years. So these are some of the synergy we do with our neighboring colleagues.
Engineer Goje, thank you so much. But before we let you go, Nigerians want to know, you've spoken about the issues which have been experienced, and you've said your governor is doing his best to fix it. We want to know the how. How many people were or are affected in your state, and what exactly has been done to help them in this recovery stage? What form of relief have they been given? What, in terms of numbers, what has been done for the people? So how many people have been affected in your state, and what specifically has SEMA done for the people within your state?
For Yobe, the total number of victims as at the last count is over 31,000. And as I said earlier, the victims cut across three incidences. One is the incidence of heavy windstorm, which affected houses and resulted in some loss of life. Two is as a result of flood due to heavy rainfall. And the third category of victims is as a result of flood due to overflow of water from Kano, Hadeja, and Guru to Bede and Jakusko. Also from the Filato, Bauchi, Kafinzaki axis to Birnin Kudu, Kiawa, Gamawa, and Yobe. There's also the other one that comes from Gombe, Daɗin Kowa, Nafada Africa, and to Jakusko and Yobe. And another one from remnants of Lake Chad through Gujiba, Fune, and down to other communities in Yobe. And all these three waters are feeders of Lake Chad. So after they reside in Yobe, they flow down through Unisari and back to Lake Chad. So as at today, the affected victims in total from all the three incidences is over 31,000. Unfortunately, we lost over 70 lives across from May to date, and out of which sadly there's a family that lost 5 members and a boat mishap that led to the loss of 10 people, which His Excellency personally visited the scene with the aid of a helicopter to commiserate with the victims and have an aerial view of the incidences and directed immediate support to all victims. In terms of support, we have 3 categories of support. The first category is during the incidents to support them with embarkment, because at a point you go to community, you will see, you give them, they don't even want the food items that you're bringing. All they needed is empty sacks with fill sands to create an embankment to redirect the water out of their communities. They want embankment to support and embark their livestock so that the water will not go away with them. So that's one part of support that we have been doing to provide them with embankment. Another support is to evacuate them to a safer location, primary schools, primary healthcare centers, and that has been done accordingly. And the other major support is to ensure that women and children, pregnant mothers, elderly are evacuated through whatever means. And that's what we use the boat hire, and we evacuated them to nearest safe highland locations. Then comes the response in terms of health services. Those that were injured were evacuated to the hospitals. They receive medical attention free of charge. Then next is the concurrent support of food items. Some we provide them, those in the IDP camps, we provide them with cooked food and medical services. And those that have resettled to some host communities, we ensure that we give them fast food. That's the first line support. The fast food would come with condiments that you can easily just boiled or use raw water to purify it. Then next, after that, we are now in the phase of recovery. So what we do is to do the assessment and know their need. Fortunately for us, and unfortunately of course, we are faced with concurrent crisis, long edge crisis of the non-state armed groups, and unfortunately there are a lot of UN agencies in our states. So we partnered with them. We conducted a need assessment with a sample size of the population affected. We took 2,000 population with almost 98% confidence interval. We did the assessment and we realized these are the needs, immediate needs of the people. So partners are now pulling resources, government is pulling resources, NEMA is supporting us concurrently, and we go into the communities and validate their need. Some of them, their need is non-food items, mattress, blanket, household equipment. Some of them, they need building materials. Some of them, they need as small as nails, roofing nails, just roofing nails. We have our zincs, we pack them. We can use our wood blocks since the water has receded now. Just give us nails, we cover our houses and we return to our homes. Some of them, they need the complete building package, cement, zinc, and these are provided by the government within available resources. Then the next phase is to see how we will support them in the full recovery by providing them with the food items for at least 3-6 months. Some of them will link them with organizations like WFP to support their food items, especially the IDP communities that have returned and are affected by the flood. Unfortunately, the federal government has released grant from the Federal Grant Reserve through NEMA, and already about 62 tons of grants have reached Yobe State, and we are researching how to support them. We also received support from the Northeast Development Commission, and we are researching still how to concretely support the victims. But then in the long term, what are we doing? His Excellency Governor Malabuni has directed us to liaise with our institution, the 2 universities in Yobe State, the Federal and State University, to conduct a research. How do we harvest the water? Instead of the water coming and destroying our communities, how do we harvest the water so much such that that water will be used for dry season farming, it will be used to support our livestock. So these are the long-term plans that we are looking up to, and this is in the pipeline. We'll soon engage the institutions and experts to conduct this research ahead of the next season. But the truth is there are a lot of indications of food security challenges. This season, people have lost their farms. It is so devastating. You see people that have planted 5, 6, 10 hectares of land washed away by water, and there's no hope for the dry season farming. Except for a few places that are into dry season, they have the expertise. We're now trying to support them with dry season seedlings from Food and Agri Organization of the United Nations. So these are the challenges we are facing, and these are some of the recovery steps that we have taken into consideration.
Okay, thank you so much, Dr. Goje, for shedding light on the situation in Yobe State and how your government and your agency is working to support the people. Thank you so much for joining us. We'll be coming back to the studio to speak to Pearl, who has visited the primary health care centers across the nation to review their current state, and we'll also talk about how the flood will affect people. So, welcome to the weekend show, Pearl.
Thank you for having me.
I understand you just finished a tour and like some analysis of the primary healthcare centers. Can you tell us what that was about?
So now in 2021, Follow the Money, the flagship initiative of Connected Development, launched a campaign to assess the state of primary healthcare centers across the country. Now in 2021, we only looked at 15 states, sampling 90 PHCs across the 15 states. Now, after that research, we discovered that 80% of PHCs fall below the standard. And then we made recommendations at the end of that PHCs should be equipped to function optimally. We made this recommendation to the government, and it's rather sad that in 2022, when we went back to these PHCs and further scaled to the remaining 21 states in the country, sampling about 783 primary healthcare centers, we discovered that the situation is not much different from what we found in 2021. And with the recent flooding, the PHCs in the affected communities are in need of help themselves, you know. So if the PHCs are in need of help themselves, how can they offer help to health outbreaks, you know, that would come up as a result of the flooding in the country?
So is there anything now that's going to be done, seeing as this situation is dire and the PHCs, clearly from what you've observed, are not up to par?
Now, Follow the Money is partnered with the National Primary Healthcare Development Agency, NPHCDA, the federal agency responsible for the development and management of PHCs in the country. And this partnership is meant to, for Follow the Money, to support the agency with recommendations and any other kind of support relevant to the situation in order to mitigate and improve the quality of PHCs. Now, we hope that the recommendations that we have made this year, which will be launched in a report this week, would be taken into consideration. Right now, one of the recommendations we're making to the Nigerian government is to adopt village health committees, right? Committees where members of the community sit down with members of the agency and co-create solutions to the problems that are unique to each community. Now, you know that you cannot make one recommendation and it would be the same across all contexts, right? All the 36 states of the Federation, including the FCT. Now, each village health committee is meant to create custom-made solutions to their own problems. And we hope also that the National Primary Healthcare Development Agencies works seamlessly with the state primary healthcare development agencies in order to ensure that PHCs maintain the standard. PHCs can adequately respond to health emergencies like the COVID-19 pandemic and other epidemics that are sure to come up as a result of the current flooding.
So now we have this flooding. In certain states, we've heard stories of dead bodies from cemeteries now floating above water because it's been washed away, and there's now the risk of cholera affecting several communities and the like. The president has just submitted the budget for the next year, and every year we have provision for primary health care centers and the likes. With Connected Development and Follow the Money, you guys follow the money. How are you people, beyond recommendations, holding government accountable, and how can the people, the Nigerians who are affected by this, hold, who should they hold accountable, and how can they hold those people accountable to ensure that they have the services which they deserve?
Now, that's a very fantastic question, because we understand that as an organization, we can do only so much, right? We cannot hold every state government accountable and the federal government accountable. Now, for recommendations to be adopted, citizens have to be the ones driving their own change. And so now what we do is to build the capacity of citizens for them to hold their own government accountable right to the grassroots communities. So we're talking about citizens in the community being able to walk up to the local government chairman and say, you are responsible for this constituency and we're not seeing any improvement. What are you doing with the monies that have been allocated? Now we know that in 2019, WHO, the World Health Organization, allocated monies for the development of primary health care, about $20 million, $20.5 million to be precise. Now, question is there a difference in primary health care prior to 2019 and now? Is there a noticeable difference? What was this money used for? Where did this money go? Now, community members need to be aware that Nigeria is signed up to the Open Government Partnership, which ensures open data and freedom of information. So, meaning that there are certain information that citizens have the right to demand documentation from the government for. And knowing this, citizens should be able to walk up to the state primary healthcare development agencies in their state and ask them what is being done to improve primary health care in the state. Why is it that we're still having antenatal challenges? We are still having children dying, babies dying, neonatal death. Why is it that we're still dealing with the most basic problems? Aren't you, how much more support can the federal government give you? What support do you need? How are you there to serve us? How are you serving us? Right, community members need to be the ones asking these questions beyond what Follow the Money is doing, and that is what we are here for. That is what we've been doing, empowering citizens to ask these questions themselves.
It's amazing what you Follow the Money is doing and you're doing. But my question now is, you did a tour last year, 2021, and did a tour this year, and there hasn't been like much difference. What assurances are there that the government will take your recommendations? Is there anything, have there been things put in place to actually follow up with them in order for you to see change if you go for another tour next year?
Now, one of the, should I say, green lights in all of this, a silver lining in all of this, is that after the research we did in 2021, and we presented these findings to the National Primary Healthcare Development Agency, and they were like, you know what, I mean, you've done this, you have capacity across the entire country to conduct a research on this scale. And we entered a partnership with the agency, you know, and so that partnership, which was signed early this year, February this year, you know, is indication that the government is listening. You know, they are interested in how citizens perceive them. They are interested in improving the quality of healthcare in this regard. You know, the government is interested, you know, and we know that perhaps this change that we are looking for, the improvement of services in the country, is not going to happen overnight. But we need to see that the government is taking steps in doing so. And so that partnership with a civil society organization such as ours is clear indication that the government is listening to the people.
Per Utuk, Program Officer, Connected Development, thank you so much for the work you do, your organization, and for sharing this with us. We, in our own way, will continue to hold government and the people responsible accountable to ensure they do their job by creating a platform and giving platform to people like you to speak about this. And to our viewers at home, if you have comments, contributions, or for sponsorship or adverts, we have a number which will be on the screen. You can always get in touch with us. For more. That's how much we can take on this segment. But up next, we have Tenda with Ogbu Chidera, the CEO of Oledo Naturals, a product which I've used and love. And she will be talking to Tenda on our Entrepreneur Spotlight. Don't go away.